Hey, well, hello everyone. Welcome to the Healthy Joints, Healthy Lifestyle Show. And not only do I have a treat for you, I think this is an amazing opportunity to talk with Dr. Amanda Adkins, because today we're going to learn what it's going to take for us to really embrace the plant-based lifestyle. And I'll tell you guys, I, for one, Dr. Aminola Dada, I need help in this department. So introduction to those who don't know me, my name is Dr. Aminola Dada. I help people with autoimmune disease get their immune system back on track, and people with joint pain become pain-free. But today it is all about how we can improve our lifestyle and how we can improve our quality of life by being healthier. And one of the tricks to being healthier is really embracing a plant-based lifestyle. And before we started, I was talking to Dr. Adkins and I was like, hey doc, I am going to need your help in this direction, right? So welcome to Dr. Amanda Adkins, and I'm going to tell you a little bit about this phenomenal doctor. She is, in addition to being a primary care doc, right? She is double certified in internal medicine and lifestyle medicine. She's a health coach. She's the owner of Enlightenment Health and Wealth. She has a deep passion for ensuring that everyone has a chance to be healthy and happy. So her focus is to help women who are overweight prevent and possibly reverse chronic illnesses. We know about diabetes, we know about heart disease. This is her forte, and high blood pressure. So with that, I'm going to welcome Dr. Amanda Adkins to the show. Welcome, Doc.
Thank you so much. I'm so happy to be here and talk with you all today.
Well, thank you so much for coming. I know you have a busy schedule, and I'm so glad you were able to take the time to come over to the show. So we'd like to know a little bit about you before you tell me why I need to stop eating the steaks that I like to indulge in every week. Okay, so what would you like to share about yourself, kind of professionally, personally, just things to help us kind of know kind of what helps you, what makes you do what you do?
Yes. So people always wonder, how did I start eating plant-based or vegetarian veganism? So I always like to just tell them, like, I grew up eating meat just like most people in the American and African-American culture. I tell people my dad actually was a meat delivery truck driver, to where we had like bologna, hot dogs, sausage, bacon, all that kind of stuff growing up, But at the age of 16, I decided to become a vegetarian. And that's because I was an overweight teenager. A freshman in high school, I weighed 199 pounds. I had a family full of cancer, heart disease, diabetes, high blood pressure. And I already knew I wanted to become a physician. And I was like, well, if I see that in my family, I know I have those genes. That's not how I want to live my life. And so I just, didn't know much about being a vegetarian at the time. I'm just like, I'm just going to try this because I want to lose weight. So from then on, I just been on this journey to learn more and more about how your lifestyle, what you eat, how you exercise, how you sleep actually plays a big role in your health. And once I started doing it, other people like looking at me like, oh, what are you doing? I want to do that too. So now I'm off to, explain to the world what I do, and hopefully impact you all to make some changes today.
Well, that is so inspiring, that even as a teenager, you were able to kind of look at, the risk factors. You looked at kind of the family, and you're like, hey, I'm going to need to make some changes, especially with my career and the fact that I want to impact and make a difference to the patients that and that it starts with me. And I guess one question is, everybody always gets a little bit like overwhelmed. Right. Mm-hmm. Even I would get overwhelmed with, oh my God, does that mean I can never eat meat again? What does it mean to go plant-based? And I'm wondering how the 16-year-old was able to kind of go from, just meat all the time, or how you tell your patients, right? Is it tomorrow I need to stop? Or how do we make that mindset? How do we get over that?
Yes. And so I tell people, I don't think I was, I was a smart teenager, but I was like, I didn't know everything at 16 years old. I'm just like, it's just what was trial and error. I'm just going to try this and see how long it works. That's all I said to myself. Every day, every meal I had, I'm like, can I not eat meat again this meal? And then after a while, it just became, that's just what I did. That's who I was. So first of all, when I have patients that ask me that, I first try to see what they actually love. Like, what's one thing they actually love and one thing that's non-negotiable. So I was like, okay, let's see, what is your non-negotiable food? Okay, so we look at that. And then I also look at what are their goals. So if they're a person, I have a lot of people that like high blood pressure, diabetes. Those are the two main things that I see people for, and that they want to make lifestyle changes. So depending on how far they are from their goal, we talk about how much they have to change. So even if you change just one thing at a time, which that's usually what I tell people to do most, is change one thing at a time, then you'll see some results. You may not get to your ultimate goal with just that one change, but as you get in the habit of doing certain things, you'll actually do better and better. So the first thing I usually tell people is add more vegetables and fruit to your diet, because usually in America, we are more fiber deficient than anything else. We eat a lot of, fast food, a lot of processed foods, and we don't actually get those whole fruits and vegetables in. So when I ask them about their diet, usually that's what they're lacking. And so we start with that, add in fruits and vegetables to every single meal, even breakfast, because some people are like, even at breakfast, I'm supposed to eat vegetables. Yes, you could eat vegetables at breakfast time. And not just, in an omelet or something like that. You can actually eat kale, you can actually eat broccoli, you can have soup, you can have a sweet potato, you can have like anything you want, but something to add in fruit and vegetable at every single meal is the first step I usually tell people to try to add into.
Yeah. Okay. So it sounds like you're saying start where you are, right? To prevent overwhelm. You want people to, you kind of encourage, hey, start, because when you were 16, you started where you were. You were like, okay, for each meal, hey, do I really need to have this meat on this plate? Rather than the 16-year-old is not really thinking, oh, for the next 10 years, I'll never have a steak. This is 16-year-old is just kind of looking at the plate and saying, hey, do I really need to have the meat on this plate? And then the next thing you're saying is rather than subtract is add. It sounds like you're saying just add more vegetables. And who said you have to have cereal in the morning, right? You can have vegetables with whatever you want in the morning, but you're saying start from a surplus mindset. I don't think a lot of people have any problems with adding things. It's a subtraction that's the issue, right?
Exactly.
But I want us to come back to this, but how about, because as you're talking to me, I'm still trying to get convinced, and I'm like, and I'm a doctor, and I know in my head, but I'd like to be told, and I think a lot of us know the right thing to do, but can you tell us why we should, what are the benefits? Why should I even switch to a plant-based? Let me hear it again. I think we all need to hear it so that we can even kind of be able to embrace the change if we understand our why.
Yes. So plant-based eating has a lot of benefits. As you mentioned earlier, our goal is to try to prevent or reverse chronic illnesses. So 8 out of the top 10 causes of death in the US are usually related to lifestyle and mostly nutrition. So heart disease, diabetes, high blood pressure, cancer, COPD, so many other things that like my mind is blanking on right now, but so many things that we're doing to our bodies that's causing these illnesses. So nutrition is number one. So if we can actually change what we're putting in our mouth, we can actually change all those illnesses. And a lot of people say, well, those are illnesses of older people, so I shouldn't have to worry about those until later on in life. So I should be able to eat everything I want up until like the age of 30 or something like that. That's why I might hear people say, I'm like, but you have one body, and what you did to your body when you were 10, what you did to your body at 15, what you did to your body at 20 is going to show up when you're 30, 35, 40, 45, 50, and so on. And I have so many of my people that are in their 50s, or, even some of my healthy 80 or 90-year-olds, they're like, you ask them what they did, and these are the things that they did when they were younger to carry on through their lifetime. So you have to think where you are now and where you want to be in 20 years. Yeah. If I'm like, I love hiking, I love walking, I love running. If I want to be able to do that when I'm, 60 and 70 years old, I need to take care of the body I have now. Yes. And so that's what I really stress when people ask me, well, why should I change anything now? Why should do X, Y, and Z? I'm like, well, what do you want to do 10 years from now? Because if you want to do what you're doing now, you have to change something. Otherwise, you're not going to be able to do those things.
Yeah.
And that usually registers more for people than you need your blood pressure down, you need your blood sugars down. It's like more functional. What do you want to be doing? Because you want to live and you want to live life. You don't want to just be sitting on the sideline of life.
That's so true. And I tell people, right, too, that you want to have a good quality of life, right? And so you don't want to be on the sideline. You don't want to be in a chair. I treat arthritis, and all that weight on the knees is 10 times. And then all of a sudden you find that, okay, your knees, you have arthritis in your knees because we didn't make these changes early. You don't get up one day at 50 and decide that your addiction to sugar, salt, and all these things, you're going to suddenly be able to break it. So developing those habits slowly is what I'm hearing you say. And also understanding that you want to take care of this one body that we have. We don't get another. We don't get to change the body.
Right. There's no body transplants. I tell people that we can transplant certain organs, but we cannot transplant your whole body. So think about that.
And you can replace the joints, but they're not the same. And those joints that you do replace them to have a lifespan, right? So no surgeon is in a hurry to give a knee replacement to a 40-year-old. They're like, well, what's the lifetime of the knee? And you're still going to be around at 60. Then what do we do? Right. So you get this one body and you get this one opportunity. Okay. So now that we understand the why, I think we can kind of embrace the how. And so you kind of mentioned that one of the first things you do is say, hey, add stuff on, add more vegetables. Okay. What else can we do to kind of move forward?
Yes. So once you add in the vegetables, then that's when we start to take away things.
Yes.
So then we'll look at, okay, what are we eating that is causing most of our problems? And so the number one thing is processed foods. So we have a lot of those, and we had to look at, are we really eating food? Are we eating, what they've been telling us is food? Right. So that is a big thing. And that's one thing I can say that I did not have the knowledge of when I transitioned from eating meat to not eating meat. So my first thought was I'm just not going to eat meat. But I still was eating a lot of processed food. I tell people I was a junk food vegetarian. So just because you're a vegetarian, just because you're a vegan, doesn't mean you're eating healthy. And a lot of us still had eaten a lot of processed food. So we want to look at that and take that away. And if you can make it in your kitchen, then it's more likely that it's a little bit healthier. Then the processed foods also include processed meats. So I just was talking about this on my own Facebook page the other day, was like hot dogs, bacon, sausage, pepperoni, all those things that are processed, they're actually linked to cancer. And so eating those things, we definitely want to try to get those off our plates and not even have them on occasions. I know people love their bacon. They tell me that all the time. So trying to get rid of that and take that off would be the next step, I would say.
Okay. Yeah. So it sounds like, the cheese, I like to make a cheese platter, but it usually has all those processed meats. And so finding alternatives to something like that too is important because it's a processed food. I would say one thing, I remember having a conversation with a friend of mine, and her husband went vegetarian. And so she and I are carnivores, but we're going to be recovering carnivores, right? And so as we're munching on our steak, we're like, well, we know a lot of fat vegetarians. And so, but I think what you said is important. It's not so much that you cut out the meat, it's also more important that, well, just because you're not eating meat, what are you eating? Right. And so she made that comment and I kind of smiled, and she was like, well, she knows what her husband is doing because she knows a lot of fat vegetarians. And I was like, I hadn't thought about that. I thought once you're a vegetarian, you're so disciplined that you would be able to kind of manage your diet. But you can end up eating a lot of processed foods that it comes in bags and stuff. So you're saying, hey, easy way for you to know that you're not eating processed food is making your kitchen.
Yes. That is so true. And like I said, it's nowadays, because the science is out there that plant-based eating is, healthier and all that kind of stuff. I tell people marketing is very brainwashing. So they have all these things out there now that wasn't available when I was 16, like, you know, your plant-based burgers, your plant-based ice cream, your plant-based cookies, all those types of things that you're like, just because it's, you know, plant-based or vegan on the label doesn't necessarily mean it's healthy. So we have to look at that closely.
It's tough, right? Because you're out there thinking, I'm trying to make healthy choices. I'm looking for plant-based food, but that's not the all be. It can be plant-based and still be unhealthy. It can be plant-based and still have preservatives. And so you want to try to make sure that making it in your kitchen makes it less likely that you're going to end up with all these ingredients that are also pro-inflammatory, right? Right. So all these preservatives and things that are used to cure meats and all this stuff, and all these preservatives you find in like a bag of potato chips also cause inflammation and can actually aggravate your immune system too. So we definitely have that in common in kind of minimizing any additional things that don't come naturally with the food.
Exactly. Yes. And then when you said make it in the kitchen, I just want to emphasize people, I'm not a person that likes to cook. So you can actually go out and, you know, get healthy things that you don't necessarily have to make in your own kitchen, but it's still healthy. Just so, because that's usually a big barrier for a lot of people. They're like, I don't like to cook, I don't know how to cook, or I don't have time to cook. So you still have that option, just so people know that out there.
Yeah, I guess made in somebody's kitchen.
Yeah, exactly. Made in somebody's kitchen, maybe just not yours.
Maybe just not yours. Hey, you know what? Hey, I mean, it's such a busy life now. It's made in somebody's kitchen. As long as it doesn't come in this bag, you know.
Or from a factory.
Or from a factory, you know, made by workers in a factory. So, you know, I had some, okay, so let me let you finish. So we kind of said you're going to add food, and then we're going to start subtraction all the bad processed foods, right? And we're going to get away from the cured meats. But even if we're eating plant-based, we're going to look at the labels, and we're going to make sure that it's made potentially in a kitchen that may not be yours, but it's still made in some kind of kitchen. But definitely you want to avoid things that are made in factories and bagged and put, you know, sourced from plants. What else can we do to kind of get us on that journey?
Yes. So if we're sticking with nutrition, then that's when I would say that's when you start cutting out animal-based meats or cheeses or dairy, things like that, because those have also been linked to heart disease, diabetes, and cancer. And a lot of people switch. They know red meat is bad because that's been pressed out to us that red meat is bad, but also, especially for diabetics and people with high blood pressure, that chicken can be also bad, or poultry, because it can be high in sodium and high in fat compared to, you know, your fruits and vegetables. So a lot of people are like, oh, well, I just eat chicken all the time. Well, I mean, I'm not saying chicken all the time is bad. Some people may still use it, but I look at it on a spectrum. So we may have the red meat, we have the pork, then chicken, and then, you know, your freshwater fish. If you're doing a protein, animal-based protein, then you can look at it on that spectrum, that you're moving away from it, but what's going to be the ultimate best? And then we compare it to like what else you could do. So instead of having, you know, your beef or your chicken or the fish, you can have lentils and beans and tempeh. You know, those have more nutrients in there than just the meat itself. And so I always try to push that. So that's the next step that I usually try to push people towards as they're trying to get healthier and look at their own goals. So I always tell people it's not necessarily that you have to be 100% plant-based, but you want to move towards that spectrum to where most of your food that you eat is plant-based. So I try to push people at least to that 80% mark, where they're mostly plant-based, because that's where you start to see more and more of the benefits for the chronic illnesses. Now you would see, you know, weight loss, you'll see more energy, you'll see better sleep, all that as you move away from just eating pure meat to more plant-based, but you don't necessarily have to be 100%.
Yeah. Okay. Well, that's actually important for us to know, right? So it's not even just the chronic illnesses, right? Because you can have someone that says, well, I don't have high blood pressure, I don't have diabetes, why are they bothering me, right? But you also have better sleep, you also have more energy, right? And a lot of us are fatigued, and some of that may be, if we made some changes to our diet, perhaps that would help. I think the other thing that helps somebody like me is understanding that, you know, if I'm coming from a red meat life, I can go down to chicken, or I can go down to pork, and then I can go down to fish, and I can gradually work my way down to where I'm eating less of the red meat, going into the chicken phase, going to the fish phase, and then, getting to where I think our goal should be. At least if we start at kind of saying, okay, the interim goal, like you're running a marathon, the interim goal is, okay, let's get to 80%, let's kind of reduce the red meat, go into the chicken, then go into the fish, and then find your way and adding more and more of the vegetables, I think makes it less overwhelming for us to just kind of, start. So we start by saying, okay, instead of steak, let's do chicken, right? And instead of chicken, let's do fish. So we start rather than kind of freezing in place. Well, this is too much for me to do, too much of a lifestyle change. I can't do it. And then you give up, right? So we don't want to give up. We want to start where we want to make progress over perfection. We've heard that before.
Yes. And that's, I think, where people, like you said, can really get into it, because they're like, I'm not giving up my meat. I don't care what you say. And then as they, transition and they start to feel better, they're like, oh, well, maybe I don't need to have meat today. Like that's where those meatless Mondays came in.
Yeah.
And so I love that now, because before I was very strict. I'm like, meat or nothing. Like, like this is all we're doing. But then I also like to point out for people that maybe like on your prevention side, you can actually go slower. But if you're a person that's been diagnosed with an illness, a chronic disease, depending on your goals, if your goal is to actually try to reverse these things, then if you talk to me, I'm going to be a little bit more harsh to you.
Yeah.
Because we have to go all in to actually start to heal, internally those arteries and, blood vessels that you've damaged over the years, to actually see the reverse changes. Because then you'll give up, because you're like, well, this is not working. I'm doing this, 50% of the time, and my blood sugars are still high, my blood pressure is still high. And I'm like, well, we haven't made enough changes yet to actually see this reverse. So I always like to give people that caveat too, that yes, we can transition, but if you're looking for, those results that really can use to reverse those chronic illnesses, we may have to be a bit more strict with you.
Yeah. I think that totally makes sense, right? If you've already been diagnosed with a condition, and if you're in a preventative mode, then the urgency of getting to plant-based varies, right? So if you're somebody who's otherwise healthy, but hey, I want to prevent things, I want to maintain a healthy life, then you can kind of be a little more gradual. But if you've already been diagnosed something, then it's a race against time, right? Exactly. And in that case, Dr. Adkins is your woman, because she's the doctor that's going to really help you, and she has a whole plan on how to help you move really quickly through and get to where you need to be, because you need to reverse, and it's a race against time. So I totally get where Dr. Adkins is coming from, and that's why you need somebody like that. If you're already been diagnosed, you need someone like Dr. Adkins on your side, and you work as a team to kind of get you to where you need to be. So that is so helpful. Okay, any other hints or thoughts on that? Because I have more questions for you.
I would say that would be, where we are with nutrition. And then as we go on, we tweak certain things. People may, revert back, and then, we'll talk about mindset and things like that for people as they move on through their transition and journey. Okay.
So I have some questions, which are specifically kind of the way I think, and I need some help with my mindset. So one of the things is, am I really meeting my protein needs with plant-based foods? Like, how many nuts or almonds, and you're going to correct me. You can see I'm coming from a place of bias, even with my question, right? I'm going to say, how many nuts do I need to eat to replace the protein I would have gotten from a steak? Thank you.
Those are things you can definitely calculate out. But I always try to emphasize to people that, one, protein does not necessarily equal animals. Like because it's protein, you don't have to think just animals. So I was like, growing up, that's how we thought. Animal products is where we get protein. You definitely can get protein from plants and different types of plants. People look at how they're actually absorbed after you eat them. So let's say they tell it, like one group was like, you can't really compare this, but if you compare broccoli and like steak, eating 100 calories of broccoli and 100 calories of steak, the broccoli has more protein, but you don't necessarily absorb all the protein from the broccoli because it has the fiber and how your body digests things. So then we'll just tell you to eat more. But like you said before we started, like you eat broccoli and you're still hungry, compared if you eat a steak, you're not still hungry. But when you're eating plant-based foods, you have to eat more of them to feel full. And even then people ask, well, because they're usually on a restricted mindset when they're trying to lose weight, is I can't eat that much and still lose weight. Okay, so one, to go to your question, you can get plenty of protein with eating plants. You may just have to eat more of them. And you may just have to make sure you're eating enough of them and the right variety. So you have to eat variety of vegetables to actually get enough protein. So beans, you can get it with green leafy vegetables. You can get it with, your starches, different things like that. And you look at it and it's not just protein, because when you think of meat or a steak, you think it's mostly just protein and fat. Whereas in, your plants, you get protein, you get carbohydrates, you get phytonutrients, you get fiber, you get a lot more things in that one food than you would with just protein. But there's a way you can actually calculate out how much protein is in a certain food and to see if you're getting enough. And in the US, I could say even vegetarians and vegans, we're not protein deficient.
Yeah. Okay. Well, thank you. That's actually, right. So that's just an excuse, right? To say, and actually, as you were talking, I was actually thinking of the mindset with that. One mindset is that, well, I don't feel full when I eat the broccoli or when I eat the plant-based meal compared to when I eat a steak. Well, are you really supposed to feel so full that you're uncomfortable and that you need a nap after your steak meal? Or should you be full enough that you can still go for a walk, right?
Right. And you should be full of energy. That's what you should be.
You shouldn't be full.
Not
you shouldn't be so full that I need to go nap. So that's part of the mindset shift, right? And then the other thing you said, which is important, is thank you very much, Dr. Dada, for that interesting question. But mind you, there are a lot of vegetarians around and people eating plant-based meals who are not protein deficient. So right? So we can look at the population and say that is the answer to that question, which is, yes, somehow, my dear Dr. Dada, they are getting enough protein from plants because we don't have a whole population of vegetarians undernourished because they don't have enough protein.
Exactly.
Okay, so you think you're helping me, right? You're helping me. Okay, am I going to need, if I go plant-based, are there some nutrients that I'm going to be missing? Do I need to take supplements? What's going to happen there?
Yes, so the biggest one that you would be missing, and it's not necessarily because you don't eat meat, is vitamin B12. So if you're purely plant-based or purely vegan, we definitely emphasize that you take vitamin B12 on either a weekly or a daily basis, depending on how much you take or how much you actually get in a supplement. And that's because the B12 is actually found in microorganisms that's in the soil. So our soil is actually not as good as it was back in the day before we would eat, the food straight from the ground. We didn't have it where it was all these other pesticides and all that kind of stuff that was killing off things. So B12 is important in the neurologic system. You don't want to, be deficient in B12. That's something we don't want to play with.
Okay.
Another one may be vitamin D. And vitamin D is because we don't actually get that a lot through food anyway. It's more through sunlight. And I tell people we don't necessarily want to be out because that risks for skin cancer, things like that. So if you were eating the best plant-based diet, you would still need vitamin B12 and vitamin D. So I would look at that. If you do a lot of variety of other foods, eating a lot of different types of foods, different type of plant-based foods and different colors of plant-based foods, you usually get mostly everything else. But you would have to be, more detailed to look specifically at what you may be missing. But B12 and D are two of the big ones that people would miss out on if they're not aware.
Well, I almost feel like I need to have you back because I still have a lot of questions. This is really so good. But let me ask you this too, is, we're trying to find a balance, and I don't know how you deal with this with your people with diabetes, but part of what, my health plan for myself is always to try to minimize the carb intake. right? So so then am I going to be eating too many carbohydrates? And how do you deal with this with your diabetic patients, right? So just kind of trying to figure that out.
Yes. So that was good. That was something I actually learned later on of how diabetes actually works and the actual where it comes from initially. So we have insulin resistance. We look at what we're eating, and most time we think of the carbohydrates because the carbohydrates turn straight to sugar, and therefore our blood sugar spikes. But then the some of the underlying things that we believe actually is causing the insulin resistance is basically from saturated fat, which you get from, meat. So if we cut that, we actually can eat the, whole carbohydrates. So when people say carbohydrates, we don't want to be eating a lot of like, a lot of potatoes, a lot of rice, but you can still have, like some sweet potatoes, you can have whole grains, you can have, your leafy green vegetables, which I tell people that's the mainstay. Your leafy greens, the kale, the spinach, broccoli, all those carnivorous vegetables. That's where you really want to be. For everyone, that's your most of your food should come from there. You're not going to be getting too many carbohydrates. So if we cut the fat, lose the fat around the abdominal area, lose the fat around our liver, then our body can actually digest and process, those carbohydrates a bit better. And I'm talking about those whole foods, not our potato chips, not the white rices and those things like that. We can actually, our body can break down, and actually our blood sugars will be better, and we won't gain weight. Our blood sugars won't be higher.
Okay. So so there are foods that have, for our listeners, I think what Dr. Adkins is also kind of talking about, foods with high glycemic index. So foods that you eat that cause your blood sugars to kind of go sky high. They're plant-based, but they can cause your blood sugars to go sky high. And so even just comparing just a regular white yellow potato to a sweet potato is less likely to cause that blood sugar to go sky high. Okay, well, good. So thank you. That was another thought I had. Thank you for crushing that. So really, there's no objection right now. I have no objection to gradually switching myself to a plant-based diet. So can you give me one more thing to seal the deal? Can you give me an example of a patient that's worked with you that had a good result, and just kind of get a visual of what it is to work with you?
Yes. So I use a patient that I had with high blood pressure. So work with her for about, I would say 3 or 4 months. And her goal was, lose some weight and try to get off her blood pressure medicine or get her blood pressure better controlled, because it was still like mostly in the 140s over 90s. We worked definitely on what she was eating. Now, I can tell you, she did not go 100% plant-based. So just so you guys know, this was not 100%, even though she did have high blood pressure. She went mostly where she was doing the first steps that we talked about, adding in more of the fruits and vegetables and having that at every single meal. And then also watching how much sodium intake she had, which we're talking about, her meat intake and how much chicken she was eating, because chicken can be high in sodium for some, some of the way that you get it or prepared. So we're looking at that. And then we also look at the other things in lifestyle medicine was her exercising and her stress level. So she wasn't realizing that her stress was playing a role in her blood pressure also, as we were making those changes with her eating habits. So she got that to where she was doing that. She was always doing exercising. And then we talked about her movement throughout the day. So we don't want to just be what they call like the weekend warriors, where you exercise, for 30 minutes and then you sit for the rest of the day, or you exercise for 3 hours on Saturday and then you're like, that's my exercise for the week. We want to be, actively moving throughout the day. And then she was able to get her blood pressure better. It was like in the 110s over 70s. And even without adding in more medication, because people think that that's what the case is, she was able to actually jog a little bit with her daughter, had more energy. And like I said, this wasn't even going 100% plant-based, being just more conscious of what she was eating and actually making sure she got in that fiber, decreasing her salt, decreasing her stress. And just seeing that, because, I talk about it a lot, but then when you actually see those life changes for people and they actually reflect back to you and like, oh my goodness, this has changed my life, because never thought she was going to be a runner, doesn't want to be a runner, but just able to do that with her daughter gave her a little bit more confidence, like, I can do this. And
I can do this.
60s,
Oh, yeah, that's fantastic. That's a fantastic story. So not only, it sounds like just multiple levels of gains, right?
Yes.
So she was winning at becoming healthier. Her weight was getting under control, reducing insulin resistance, reducing abdominal fat, becoming more fit, actually having more in common with her daughter, increasing the family bonding time. It seems like just somebody who kind of just got wins all around. And that's enough to kind of give you like some positive reinforcement to say, hey, I'm definitely on the right track. Good for her. She became a walker to a runner. Good for her. Well, let's do this. Just because we're kind of running, I'm going to have you back because I think there's so much to unpack in kind of having that plant-based lifestyle. But I think we've been able to kind of get people like me kind of more on board in terms of our mindset and all the reasons why we wouldn't want to do that. So I think you've actually already given us some tips and really helpful in terms of, I love the fact that we're not going to start with subtract, you're going to add. We're going to add, and then we're going to say, okay, now that you've added, the greens to your food, then the next thing is going to say, well, yes, now you're eating plants, but well, what kind of plants, right? Are they more healthy, or are they things that come from a bag that are processed? We want to get rid of processed stuff. And then the third thing would be, we want to look at the spectrum. I want to say, well, get rid of red meat. You can move to chicken, you can move to fish, and then you can move to 80% plant-based food, but depends on where you are, right? If you already have diabetes, hypertension, and chronic disease, then you need to kind of speed up. You need someone like Dr. Adkins to kind of get you to where you need to be. If you're kind of thinking more preventative, you have a little more time, but don't spend too much time. Don't let it take you a decade. You ain't got time for that. But we want to make sure that we're living healthier. So Dr. Adkins, tell me, what superpower do you wish you had? This is my fun question, and why?
Superpower.
I tell you.
Yeah. The only thing I can think of is I wish I can fly, because I like going to the beach and being, in warm areas. So like I would want to be like a bird and fly south for the winter.
I love it.
And get there immediately, not waiting for the airlines.
Not waiting for the airline, not dealing with cancellation of, cancellation of like, and if you're healthy and you're eating plant-based, maybe one day you will.
It's like, I'm just taking off. See you guys next summer.
I love it. So how can they find you, to people who want to work with you, how can they find you?
Yeah, so I tell them to find me on my website at www.dramandamd.com. So DRAMANDAMD.com. I'm also on Facebook at Dr. Amanda Adkins, and it's spelled ADKINS. So I tell people I'm a lot different from the other Atkins that you may know. And then on Instagram or YouTube. So I have little, videos there that people can watch to get more helpful hints.
Okay, and so we're going to actually have that information in our show notes. Thank you so much, everybody, for watching. Remember to subscribe to our YouTube channel at Healthy Joints, Healthy Lifestyle. We love the fact that Dr. Amanda Adkins was able to come today. Thank you so much. It's actually helped me personally, and also it's going to help so many of my patients, because I'm going to be able to tell them, hey, spoke to Dr. Adkins, this is what she recommends. For those of you who are in the greater Seattle area, come see us if you have any autoimmune disease. But if you are Dr. Adkins, how can they find you in person though?
So in person, I actually work in Northern California. So I am in Fairfield, California with my practice. So right now I'm I won't say popular, but have had a lot of influx of people. So we're not accepting new patients at the office, unfortunately, me personally. But if you definitely call, they can, get you on a wait list if you want to see me in person. So that's a little bit of a different story. We're trying to get into that.
Okay. Well, you know what? You are amazing, and I'm not surprised. There's a wait list to see you. But that's, hey, that's what it takes. But anybody that wants to see you in the area should probably call, at least get on the wait list. Better than not being on the list at all. And then if you want to work with Dr. Amanda Adkins, kind of from coaching standpoint, you can also reach out through her website. Well, thank you so much, everybody, for listening. If you're in the greater Seattle area, look us up at overlakearthritis.com and subscribe to our YouTube channel. More importantly, if you know someone that's going to benefit from this, share it, love it. And thank you so much for watching, everybody. See you soon.
Thank you.